Assalamualaikum warahmatullahi wabarakatuh. Hello and good pleasure to all lecturers and everyone that will be watching this video presentation. My name is Ahmad Iman bin Abdul and I am a year 1 medical student. Today I am very pleased to be presenting to you guys about the digestive system. As for the agenda of the presentation today, I will be focusing more on the anatomy of the digestive system, the physiology of the digestive system, metabolism of the digestive system, some of the diseases and treatment that can be used to treat the diseases, and also one of the most famous practitioners in this field. We begin this presentation with the anatomy of the digestive system. As you guys can see from this picture, this is the anatomy of the digestive system and all the organs that included in this system. Overall, the organs in the digestive system can be divided into two groups, which are gastrointestinal tract, GI tract, and also the accessory digestive system. The gastrointestinal tract or GI tract, that we also known as alimentary canal, is a continuous tube that extends from our mouth to anus through thoracic and abdominopelvic cavities. The organs included in this group including mouth, most of pharynx, esophagus, stomach, small intestine, and also the large intestine. The length of this tube is 5 to 7 meters in a living person because of a sustained contraction. It is longer though in a cadaver due to the loss of muscle tone after death. Next, the accessory digestive system, including the teeth, tongue, salivary gland, liver, gallbladder, and on to the physiology of the digestive system. So, overall physiology of the digestive system is for us to absorb nutrients from the food that we take. But what about the specific physiology of that certain organs that is included in digestive system? So first we have the mouth. Mouth is important for the mechanical digestion. So what is the mechanical digestion? It is actually chewing of the food. So chewing of the food will break down the molecules into smaller particles. Next, we have the salivary gland. Salivary gland is important for the chemical digestion. So, salivary gland will secrete saliva that contain enzyme that will initiate the breakdown of the carbohydrates. Next, we have esophagus. Esophagus will coordinate muscle contraction to move ingested food from mouth to our stomach. Next, we have the stomach. Stomach will secrete gastric juices to break down proteins into smaller peptides. Stomach also will initiate the stomach muscle contraction in the stomach churn. Next up, we have the pancreas. What pancreas will do? Pancreas will secrete enzyme that into the small intestine to further break down carbohydrate, proteins, and fats. Next up, we have liver and also gallbladder. Liver will produce bile that will be stored in the gallbladder, and then the bile will later be released into the small intestine. The next organ is the small intestine. The small intestine is important for nutrition absorption. So the enzyme from small intestine and also the pancreas will continue the digestion of the food. Next, we have the large intestine. Large intestine will absorb water and electrolytes from the undigested materials. There is also bacteria inside this large intestine that will ferment the undigested materials. The last organ for this digestive system is actually the rectum and anus. So fecal materials will be stored in the rectum and later it will be released through the anus. Next up, we have the metabolism of the digestive system. So what is metabolism? Metabolism is basically processes that happening in the digestive system. There are total of six processes that is happening in the digestive system. So first up, we have the ingestion. Ingestion is a process involves taking food and liquids into our mouth. Next up, we have secretion. Secretion, each day, cells within the walls of the GI tract and also the accessory digestive system will secrete a total of 7 liters of water, acid, buffers, and enzyme into the lumen of the GI tract. Next up, we have mixing and propulsion. So, alternating contractions and relaxation of smooth muscle in the walls of the GI tract will mix the food and secretion and propel them toward the anus. This capability of the GI tract of mixing and move material along its length, we call it as mobility. Next up, the fourth process is digestion. So in the digestive system, we have two different types of digestion, which is mechanical and chemical digestion. So these two digestion will break down food into smaller particles. In mechanical digestion, the teeth will cut and grind food before it is swallowed, and then later, smooth muscle and also in the stomach in small intestine will churn the food. So as a result, the food will become dissolved and also it will be mixed with the digestive enzyme. In chemical digestion, the large carbohydrates, lipid, protein, and also nucleic acid food will be further split into smaller molecules by using the process what we call as hydrolysis. Then digestive enzymes produced by salivary glands, tongue, stomach, pancreas, and also small intestine will catalyze this catabolic reaction. A few substances in the food can be absorbed without chemical digestion. So an example of this food is actually vitamins, ions, cholesterol, and also water. The fifth process is what we call as the absorption. So the absorption is actually the entrance of ingested and also secreted fluid and ions and product of digestion into the epithelial cells lining the lumen of the GI tract. That's what we call as an absorption. So absorb substance will pass through the blood and limbs and will be circulated to cells throughout our body. So the last process in this digestive system is what we call as defecation. So defecation happens when wastes in digestible substances and also bacteria and also cells left from the lining of the GI tract and also some of the foods that is not absorbed into our body. This group will leave the body through our anus in a process that we call as defecation. So the eliminated material is what we call as feces or stool. Next, we will move on to some of the diseases related to the digestive system and treatment that can be used to treat these diseases. So in this presentation, I will be focusing more on the gastrointestinal oncology, which means it is more related to cancer. First up, we have the colorectal cancer. So, what is the symptoms of the colorectal cancer? It is present in change of the bowel habit and also intestinal bleeding, abdominal pain, weight loss, and also obstructive symptom and also anemia. Then how we treat colorectal cancer is by using surgery or chemotherapy. Next up, we have the pancreatic cancer. So, pancreatic cancer, the symptoms that the patient may experience are weight loss, abdominal or back pain, painless obstructive jaundice, which may be relieved uh, using what we call as biliary stent placement. Then, what can we do to treat this cancer? So we also do surgery and also chemotherapy, but for patients that are operable, we will do a procedure what we call as post-operative adjuvant gemcitabine chemotherapy. So next up, we have the esophagogastric cancer. So this particular cancer, it is comprised of two different disease entities. So first we have the what we call as SCC or squamous cell carcinoma that present in the esophagus, and also the adenocarcinoma, the second type that present in the third distal part of the esophagus. So as how do we treat this type of cancer? So for the first type, which is the SCC, the patient will undergo a chemotherapy that what we call as combined platinum based chemoradiation with curative trend. As for patients that experience the second type of cancer, esophagogastric cancer, which is the adenocarcinoma, the patient will undergo pre-operative chemotherapy followed with surgical resection. So the last disease that will be discussed is hepatocellular carcinoma. So what are the symptoms that patient may experience if they are suspected with this type of disease? So the presentation is not specific. So patient may sometimes experience abdominal pain, weight loss, fullness, and also anorexia, and also an abdominal mass, or signs of chronic liver disease. For the last part of this presentation, I will be introducing you guys with one of the most famous practitioners in this field. This is Dr. STQ. She is the well-known gastroenterologist in Malaysia. She has more than 50 years of experience and also countless awards for her work. She specialized in colon cancer, gastrointestinal disorder, and also hepatological disorder, inflammatory bowel disease, colonoscopy, and also gastroscopy. She in her career she has been seated in a few positions. Some of them is past master of the Academy of the Medicine Malaysia, past master of the College of the Physician, and also past master of the Malaysian Society of Gastroenterology and Hepatology. That's all for my presentation. Thank you for your attention.